Okay, you're on.
District, you know?
Yeah.
Like for my district, June.
Okay, everybody, we're ready to get started. Welcome, everybody, to the state capitol. It is March 20th, 2013, and today is the day that Governor Dayton is expected to sign the new health insurance exchange bill into law. And my name is Joel Albers. I'm from Co-op Care. Co-op Care is here today at the Capitol to say that we need an alternative to the Big Four insurance company if this health insurance exchange is going to have a level playing field. My name is Joel Albers. I am a health economist. I've been doing research in this area of health economics and the healthcare system for 20 years. I'm also a PharmD, a doctor of pharmacy, meaning I'm a clinical pharmacist. I am contracted with Minnesota's Medicaid program to do direct patient care workups of medication reviews to improve people's healthcare outcomes and lower costs. Co-op care, first I'd like to define what co-op care is. Co-op care is an emerging nonprofit cooperative health insurance pool that will be everything that the monopolistic health insurers are not. We are for people, not for profit. We will be accountable, trustworthy, cost-effective, socially responsible, and above all, produce high-quality health care to our members and Minnesota at large. So that's why we're here today, is to say that we need an alternative to the profit-driven four insurers that control health insurance in Minnesota, and that we need to find a way to reduce those barriers to entry so that smaller insurers can come on the exchange. We have a couple of speakers here today, and then we have a PowerPoint presentation and a video promo. I just want to, by way of introduction, just to set the context of this, as I said, the health insurance exchange bill will be expected to be signed by the governor today. And just to make this understandable, what this does, and this is probably the biggest change in health insurance in Minnesota in the last 50 years, other than 20 years ago when frankly the insurers kind of took over everything. But the health insurance exchange is designed to do two things in trying to create sort of level the playing field and create lower premium prices and to introduce competition and to standardize the benefit policies, to make them standardized and interchangeable so that consumers can actually compare the products, compare the quality of these benefit policies, and compare the premium prices. So that is the overall objective of the health insurance exchange, and we have speakers here today who are going to explain why, when you have four dominant insurers controlling literally 90% of all insured people, that's considered a quasi-monopoly in economics, very clear basic economics 101. Why those conditions are not likely to be met with the health insurance exchange. What we're here today to do is to say there are two other conditions which will level the playing field that have not even been addressed. One is to reduce the barriers to entry to allow smaller insurers to get into the marketplace. So, in other words, in order to level a playing field, you need a lot of buyers and sellers. And when it's dominated by four big insurers, that can't happen. So we're here to talk to legislators, policymakers, and the public to find ways to lower the reserve. The reserve requirements are set extremely high. The amount of capital needed to form insurance companies, sort of, by way of analogy, you've heard of the health insurance exchange being described as sort of like the Travelocity of airlines, where you can go to a website, you can go online, and choose your, your airline. So that's the analogy. Our analogy for co-op care would be that we're sort of like that low-cost airline, sort of like Southwest, who actually has a quality product and actually caused price wars with the monopolistic airlines, and that actually did drive down the prices. So those two conditions, you need more insurers than 4 monopolistic insurers in order to make this thing happen, and then you have to do that by reducing the extremely high barrier to entry, which is the reserve requirements. And so we're here today to ask legislators, policymakers, and the public to find ways to help fund and by way of loans to smaller startup insurance companies to really level that playing field. So I would like to start with our first speaker, who is David Allen, and he will introduce himself.
Thanks very much, Joel, and hi everyone. My name is David Allen. I am the Chief Financial and Operating Officer of Co-op Care. I have 3 things that I want to express today. First is that we are a serious organization that is prepared to go into operations and improve healthcare in Minnesota and lower costs. Second is explaining why we will improve quality and lower costs. And third is explaining exactly what we need from our public officials in order for this to happen. So to begin with, we are prepared to implement a plan. We have a very detailed business plan that has been developed under Joel's able leadership. We have a management team prepared to step in and operate this firm. I share a little bit of my background. I have a business degree from the Wharton School. I was the accounting manager for PruCare of Houston in Texas. I was the Director of Administration and Chief Financial Officer of PruCare of Illinois, Prudential Healthcare Plan of Illinois in Chicago. I was the CEO and Vice President of Prudential Healthcare Plan in Oklahoma City. I also have been National Head of the Healthcare Practice for the 7th largest accounting and consulting firm in the country. And I was Chief Executive Officer and President of Minnesota Specialty Physicians, a network of 600 physicians here in the Twin Cities that managed $90 million worth of contracts for the big health plans. So I believe I have excellent background to undertake my responsibilities here, and that we have a good team and that this is a feasible plan. What is this plan? What is Co-op Care going to do? Co-op Care is going to lower costs and improve quality. How's it going to do that? Well, as Joel mentioned, we are dominated now by 4 health plans which do not offer good value to Minnesotans. They waste tens of millions, hundreds of millions of dollars. How do they do that? And how will we be different? Well, one thing is we are going to be organized as a cooperative. We are membership owned. We're going to be a transparent organization. We're going to be democratically operated. People will be able to see how the dollars come in and where the dollars go. That's going to make a big difference. We will not do what the big 4 health plans do and mysteriously build what by some estimates are $160 million more to the government than their costs actually are for providing Medicare and Medicaid services. We will not accumulate, as Joel mentioned, unnecessary reserves to the tune of hundreds of millions of dollars of premiums paid by the state, by the federal government, by businesses, by individual policyholders to the 4 large health plans, and they just put it in the bank. Hundreds of millions of dollars of unnecessary money taken out of our economy and put in the bank accounts. We will also operate lower administrative costs. How will we do that? One is that we're not going to invest in expensive unnecessary computer systems that basically control what care people get and what things are paid for. We're going to take advantage of the existing infrastructure that the state provides. We're going to use the latest technologies, and I think Rakesh, the next speaker, will talk a little bit about systems. He's one of our systems experts. We're also not going to pay excessive executive salaries. My wife's not happy about that, but that's the right thing to do. And we are going to keep a low overhead organization. Finally, the money that we actually collect in premiums is going to go much more to hospitals and physicians and pharmacists and dentists than the money that is collected by the big health plans. The big health plans have a number of ways that they divert money from our healthcare system, diminishing quality, causing shortages of physicians and specialists. One way that they do that is through something called disease management. They have contracts worth hundreds of millions of dollars with for-profit investor-owned companies where basically nurses in cubicles in places like Nashville, Tennessee, call Minnesotans and say, you know, are you eating right? Are you getting exercise? Well, that's diminishing quality, because what it does is it takes money out of the pockets of our local doctors and our local hospitals who could do a much better job, who actually know people, know their patients, and could treat those patients if they had adequate reimbursement to provide that disease management themselves. But the big health plans would rather divert that to these for-profit companies outside of the state. We will not do that. So all of those things together are going to make co-op care a much better organization for Minnesota. It's going to save people money. Our premiums are going to be highly competitive. What we collect is going to support our local healthcare providers so that we can address issues of shortages and inadequate compensation to the provider organizations. They're going to be democratically operated so that we aren't going to be able to, although we wouldn't even want to, accumulate unnecessary reserves or cheat the government. So why should we be supporting this? Well, if you happen to be an advocate for single payer system, co-op care represents a path to single payer. If you happen to be an advocate for a competitive healthcare system, we are restoring competitiveness to the healthcare system. Everybody, regardless of your political views, should be supporting this. And what do we need in the way of support? We need our government and public officials to do just two things. One is that with a new health insurance exchange, they need to make sure that the people running the panel are advocates for a competitive healthcare marketplace. They can't be cronies of the big four health plans interested in protecting the big four health plans. They need to be advocates for bringing competitive health plans like co-op care and like several others that are available in the state into the health exchange and making it easy, not difficult, for them to be in that marketplace. The second thing they need to do, as Joel mentioned, is they need to restore the funding that was taken out as part of the fiscal cliff negotiations in Washington, D.C. The original Accountable Care Act, also known as Obamacare, included low-interest loans for cooperative health plans because the people in Washington understood that a plan like this would increase competition. And unfortunately, due to Congress's inability to manage its budget effectively, they cut these low-interest loans out, and all of the preparations that we had done needed to be steered in a different direction. So the federal government could help by restoring funding. If that doesn't happen, it would be just the common sense thing to do for our state to provide these low-interest loans to an organization like Co-op Care, because while we need $10 to $20 million to get an organization like this launched, it will save hundreds of millions of dollars for the state and for businesses and people. So the return is wonderful. So two things: make sure the Health Insurance Exchange is a organization that promotes competition, not inhibits competition, and restore the funding for co-op care and similar organizations. That's what I had to say. Thank you very much. And, Jeff?
Thank you. My name is Rakesh Sharma. I am on the board of directors of the Co-op Care. I was brought in by Joel to basically help this organization to deal with its IT, the technology side of the organization. As we know, in order for any insurance company or any healthcare organization to operate successfully, it has to have an effective IT system through which it can basically manage its members, do the claims processing, have a physician network, and all the information that is needed to be basically installed over there. My role is to evaluate technologies, look at what kind of a hardware this organization needs, and how the whole thing is going to get implemented. As was mentioned by the previous speaker, that this organization is going to be effective because it does not want to waste money. It is not going to invest a lot of money in the technology or on the wasteful products, the non-value added products. That's why it's going to be more effective in delivering the kind of quality services to its members. One of the way to do is to make sure that its IT department is not going to eat up its 25% of the budget. That's very important. So that's where my role is, and I'm trying to do my best to evaluate how we can do this effectively. As Joel had mentioned that about Velocity City, I believe, and when he mentioned about the Southwest airline. See, the Southwest airline believed that you need to go from point A to point B, so everything in between was a fluff. So that's how they could reduce the cost. We are trying to do the very same thing. So we are trying to figure out, this is exactly what you need, these are the features that you need, this is the technology you need, and this is how much it really should be it should cost you, which obviously you can distribute on the your memberships so that you can bring down the cost significantly. And that's exactly what I'm trying to do over here, to find ways to minimize the investment needed on the technology to make this organization very effective. At the same time, I am not going to compromise on the HIPAA laws, on the other kind of rules and regulations to make sure that this organization is meeting all the rules and regulations that are required for a healthcare organization to be in operation. So that's my role, and I am trying my best to see how we can do this effectively. Thank you very much.
Thank you so much, Rakesh Sharma and David Allen, for the excellent, outstanding presentations. Again, my name is Joel Albers. I should also mention that I am the chair of the Co-op Care Board of Directors and the project manager on our startup insurance pool, trying to bring all of these components together. And the next part that we're going to be talking about, first of all, I would also like to thank Jim and Joan Steiner for all the beautiful artistic background that we have here today. The Co-op Care banner, which we painted at the Heart of the Beast Theater, which, by the way, is a supporter of this, the arts organizations, and this beautiful sign here, and types of banners like that, or placards like that. Finally, I would like to just offer a brief PowerPoint presentation, which I'll have to do from here, in case you need actual evidence, healthcare economics evidence that's backed up by research to substantiate the claims that we're making here. But we've talked about the Big Four and monopoly behavior, and I'd like to actually prove that in a few PowerPoint slides here. So